Urinary incontinence. For many women, it's embarrassing to talk about, let alone seek treatment. But a new Stanford study shows how yoga, pelvic yoga, can provide some much-needed relief. Tell me about your study. Who did you study?
Well, we studied particularly women between the ages of 45 and 90. However, we think that the same findings could be generalizable to younger women. There are two primary kinds of incontinence. One is stress incontinence, where the muscles of the pelvic floor have been weakened by childbirth, by gravity and time. The second type is urgency incontinence, where the bladder squeezes too much, and that's controlled a lot by the central nervous system. We randomized women to either a 12-week yoga therapy class with 2 sessions with an instructor, 1 session on their own, or 12 weeks of physical conditioning. And what we found is that both groups had a statistically significant decrease in their incontinence episode frequency by about 65% in the yoga group and 55% in the physical activity group.
How prevalent is the problem of UI?
Very common. It's not something we talk about, but about a quarter of reproductive age women and 50% of menopause and postmenopausal women will have some problem with urinary incontinence.
Yet some women don't seek treatment because it's embarrassing.
Years ago, it was completely stigmatized. Women simply did not talk about it, or maybe around the dining room table with the other women. We say to doctors, if you don't ask, they won't tell, so please ask your patients about incontinence. There are very easy ways to start treatment.
And one solution is yoga, pelvic yoga.
Exactly. It's very common yoga. It's Yyangar yoga with like 16 hatha poses, which are very common, and they're done in every yoga studio across the country doing this type of yoga.
By holding this pose, keeping that stability, you're working your pelvic floor muscles and really working on bladder control. So Warrior 2, great pose.
It's slow, sustained stretches, and it's mostly based on core and posture, as well as breathing. And we think that actually the breathing may be part of the mechanism of action for yoga on incontinence.
The good news is, even though you're embarrassed, there is hope.
There's a solution. You tell me.